the whole discussion on IPRs from the government of India appears dishonest because it is sitting on an IPR of Covaxin, not giving open licenses to mass produce it, and yet is pontificating to the world as to why IPRs should be waived. But no doubt about it, we are all in agreement that IPRs on vaccines should go wherever they are being implemented in the world or in India. They have no place in the midst of the pandemic. There is no room for profiteering in the midst of the pandemic. Vaccines belong to people, and it should belong to the people. Thank you. That's my opening remarks. I'll be happy for a discussion.
Thank you very much, Professor Ramkumar. So it's very insightful, and also one comment is that we need an open science, but what is we have is a gated science, and also the government, which is the RSS BJP regime, is for the gated science. And in order to protect that image, that they are dealing it as a political image rising issue rather solving the people's one. And also I like to mention that when we were studying in college, that there are a lot of conferences will be organized on intellectual property rights, and the brainwashing starts there. So that has to be also counted, especially we from the most of us from the middle class thinking that innovations for our prosperity is not the fact.
Thank you. And thank you to Mr. Ramakumar. Wonderful, wonderful, very erudite and insightful. I learned a lot. My question is actually, I guess, twofold. First, given that the Indian government can actually start opening up the IPR regime and getting other companies involved for the quick production, which is required right now to save lives. First of all, what kind of pressure can be put on the Indian government? I know the first task is to educate people, which is what you're doing, which is really great. But after the education, what can we actually do to, get this into the public policy arena? It seems that there was a letter written by the opposition recently, but this particular issue was not specifically mentioned to the depth that you have detailed it today. So yeah, if you could just comment on that. What are the next steps to actually advocate for faster rollout of the vaccine with other companies, so that the Indian government itself stops being an impediment for the safety and security of the Indian people?
Okay, that's a complex question because it's very easy to say what we have to do, but but the political economy of it is much more complex and difficult to maneuver. The two issues here. The first issue here is a complete absence of any kind of self-criticism, any kind of openness to accept criticisms on the part of the government of India. Government of India continues to believe that that its policy from January 2021 on vaccines was correct. It has not yet accepted that it was wrong, though it has made U-turns after U-turns multiple times. So there is this openness to criticisms and course correction which is required on the part of the political establishment, which is completely lacking. Instead, it has pointed to everyone who is critiquing it as anti-nationals, and more recently, it has said that the need of the hour is to spread, quote unquote, positivity. And those who are spreading negativity are actually anti-national people. That's a very interesting political campaign that is currently taking place. What is to be done? There are two important things. The first is that the Indian government should do at home what it is demanding globally. Okay, Indian government, if it is sincere in saying that IPRs should be waived in the WTO or globally, it should show or demonstrate the possibility at home where the government is sitting on a one good IPR. Right? That is to be done. That is a very important first step to be done, but they are not doing it. They have allowed now, after so much of campaign, they have allowed 2 companies to make it. But those 2 companies have not made any investments on producing the 2 vaccines. So they are going to invest. So the first production is unlikely to come before 12 months from now. Because you should have made last year the investment, then it would have made production now. But they are investing only now, right? So example is the Hafkind Institute in Maharashtra, where they have said, okay, thanks for the investment, but we can make the first batch only by 12 months from now. What's the point? The second important thing is the Indian government, even for those products for which it does not have IPR, for example, the Oxford vaccine, it can invoke, according to the Patents Act of India, invoke the provisions related to compulsory licensing of these technologies. So compulsory licensing of these technologies means that these patents will not be applicable for a temporary period, and then it can give mass licenses to produce in India. That is also possible for the Indian government to do. So these are the 2 things that the Indian government should do in order to produce more vaccines. The third important thing that the Indian government has to do, it has to withdraw the completely reactionary and anti-people new vaccine policy announced on April 19th, whereby you have liberalized vaccine sales and deregulated vaccine prices, thereby allowing duopolistic companies to make super profits at the expense of the taxpayer, and also making vaccines unaffordable, costly, priced for the millions of poor people of this country. It is an anti-people position, and that has to be corrected. So as a result, vaccines should be given free and universal. So these are the 3 things that I would say one has to demand of the central government in India with respect to the provision of vaccine production, sales, and distribution.
Thank you.
So, Ram, so what is the response from the states, especially how the states are managing since the burden is transferred to them? And especially they run the entire PowerPoint presentation for the entire Gujarat model. They build the Gujarat model. So how the Gujarat, UP, northern states are doing on this one and comparing to the southern states? Yeah. Another contradiction within India.
Gujarat and UP are disasters. So, I mean, it's very sad that the latest news that has come in from yesterday onwards is that you have scores of dead bodies which are floating in the river Ganges because people have simply because of absence of space in crematoriums and funeral houses, they have simply dumped bodies of their relatives, friends, etc. in the river Ganges, which is also a religious act sometimes. And that is the most unfortunate picture that you see from northern India today. You also see one news item I saw yesterday was that there are large numbers of open funeral grounds that have emerged on the sides of the Ganges, whereby people are being cremated on a mass scale, and there are no death certificates involved here. There is no count of people who are dying here. So basically, when the government says that our case fatality rate is only 1.4, it is basically based on numbers that it has, and those numbers are wrong. Right? There is a huge underreporting of deaths, and it's based on that underreporting of deaths that it is claiming a case fatality rate of 1.4%, which is completely wrong. In fact, one estimate actually tells us that India may have, while India accepts only about 4 lakh deaths, 3 to 4 lakh deaths now, the actual number of deaths that may have already happened may be between 10 lakhs and 15 lakhs already. Okay, that means the official Indian numbers are underestimates to the count of 3. Right now, this is another important facet. So the situation is very bad across the country, and particularly so in states like Gujarat, Uttar Pradesh, etc., where the public health system is historically very poor, and the governments ruling currently, the state governments ruling these states, are completely incompetent and inept in handling the pandemic. making the Kumbh Mela happened in Uttar Pradesh and Uttarakhand. Recently, you saw how many lakhs of people converged onto that site there. It was very clearly a classic case of a super spreader event that happened. You saw exactly the same in the beginning of the pandemic last year in Gujarat, when the Gujarat government and the government of India co-hosted a huge event where Donald Trump came, and and that became another super spreader event. So instead of controlling for all this, then the elections happened. There was the request made to the election commission and the government to combine some of the phases to reduce the spread of infections. That was also not done. So the government of India, particularly some of these state governments in the northern part of India, are complicit in the spread of the pandemic and the situation that we find ourselves in today. There is also the related issue of complete lack of competence or effort in generating enough oxygen for the people living in these states. People are dying not necessarily of COVID, in the sense that they could have been saved if there was enough oxygen available. Hundreds of people have died simply because there is no oxygen available in hospitals. And this is yet another facet of incompetence that you see. A contrary situation you will see in a state like Kerala, which has made enormous public investments over a period of time, where there is a communist government in power, which has been re-elected in the elections, the votes were counted on the 2nd of May, with a huge mandate, primarily because its efforts to respond to the pandemic and create conditions for people during the pandemic were exemplary. So it had announced that nobody will go hungry during the pandemic. It had announced that it will make a huge expansion in oxygen supply, hospital beds, etc., and which made it possible. So here is a state which is very densely populated, Kerala. As a result, infections will necessarily spread very fast, and it has spread very fast. Caseloads are very high, but there is no real scary situation as it exists in UP or Gujarat. If you have COVID, you have enough hospitals, you have enough hospital beds to go to. They're clean, hygienic, well maintained. There are medicines, there are doctors, there are nurses, there are oxygen cylinders available. So even if caseloads are high, if you make appropriate public investments and interventions, it is possible to regulate or to reduce the kinds of miseries and pain that would actually follow from it, as you see in Gujarat, Uttar Pradesh, etc. So there is a complete contrast across states in doing so. And further, governments like Kerala, in Kerala state, have also announced that they will give vaccines free of cost. Whatever it takes, they will pay it from their budgets and give it to people free of cost. That's yet another facet of their interventions. So I agree. So my quick response to you is there are major interstate differences here, and states like Gujarat and UP stand on the one end of the spectrum, and states like Kerala are at the other end of the spectrum.
Thank you, Ram.
Dr. Ramkumar, I wanted to thank you for an absolutely amazing talk. Although it makes me want to weep for India, it breaks my heart. I also want to congratulate you for just speaking so frankly. And in this context, that's India today, in the current political context, you're also speaking very courageously. So that really warms my heart, and thank you so much for that. My question is, like you said, it's well known, it seems at this point, that several people have said, that the death count is, vastly undercounted. And in so many other ways, so many other kinds of numbers are completely unreliable. So given that, how can we ever hope for good policy to emerge when you don't have good data? So what are people like you? There are many others who are also, very aware of what's happening, and who want to spread the situation. So what are they doing, whether it's about vaccine production or about maintaining good, honest data? And how can people like us, like AKSC, like some of us who care about this, how can we strengthen those efforts?
The question of data accuracy and openness in sharing correct and accurate data is very important. a new government has come to power in Tamil Nadu, led by MK Stalin. And Stalin government's one of the first decisions by the Stalin government was to ask bureaucrats to report data correctly. If it is a bad situation, please say it is bad. Don't hide it. It's a very welcome thing. Which uh, if you are from Kerala, you would know that the highest TRP shows in the televisions are the press conferences of the Chief Minister. Pinarayi Vijayan, which happens at 6 p.m. every day, where the first opening sentence of that press conference is how many cases were there today and how many people died. And even if the numbers have risen by 100%, 200% at all, Chief Minister would simply state the truth. And and he will not overplay it, he will not underplay it, he will just tell people the truth. And telling the truth is very important. The Indian government is talking about spreading positivity, and it is trying to spread positivity through lies, right? And in just today morning, I posted a thread on Twitter. I'll just share it here now, where I have tried to say positivity for the government of India today means telling lies. In fact, positivity should mean, however bad the news is, tell the truthful, share the truthful news with the people, data with the people. That's very important. Many states in India are, as you correctly pointed out, are completely underreporting the data just to show off a positive face for the state. It's actually making the situation worse, because if you have poor data, that means your planning will also be very poor and inadequate. You are only making your own situation worse in the near future by doing so. So what are people doing? People are doing multiple things. Some people are trying to generate their own data sets. Okay, and I'll tell you one example of a very interesting journalist in Gujarat. What he does is, every day morning he takes the newspaper, and you have seen Indian newspapers, you know that there are obituary pages with small photographs and 4 sentences about the person who died. And that person finds that in Gujarat's newspapers, for example, in one edition itself, one district itself, like Rajkot, there were usually about 25 to 30 obituaries on a daily basis that appeared in that newspaper. But in the last 2-3 months, it has risen to 250 to 400 obituaries. So from 30 or 40, it has gone to 250 to 350. That's the kind of increase you see. But the government says there are only 60 COVID deaths. Well, the number of obituaries have risen by 400. The government says there are only 60 deaths. And so that person is constantly posting this on Twitter, saying, today the government says this, but this is the number which is appearing in obituaries. Similarly, others are collecting data independently from crematoriums. Okay, and putting it out, saying the government is saying this, but this is what the total number of bodies cremated in this crematorium were. Then they are not matching. So a lot of efforts are going on independently like this to bring out more accurate numbers to the public domain. But at the same time, we should understand that these are isolated events. These are small cases, and they cannot be generalized. We have to constantly put pressure on the government itself, because that's the only agency which has enough inside information and data sources to put this out. We should tell them to put out the truth, and that is a political movement in itself. We are trying, and across the world, people like you can actually identify these sources which put out information truthfully and maybe try to amplify them. That's one thing that you can certainly do.
Thank you. Thank you, Anu. Thank you, Ram.
So thank you for this great talk. Yeah, I mean, another thing that is clear that in terms of the underreporting is just the lack of testing. So India has among the large countries one of the lowest rates of testing, per population. So if you take on the average, only 1 in 5, assuming each person that no person gets has taken more than one test. Only 1 in 5 has ever been tested. So there must be tremendous underreporting of just the incidence of COVID. But I want to ask you another question, and that is that earlier, like in the autumn of last year, when we had the surge of COVID cases in the US and Europe and other places in the world, India seemed to come through. I mean, throughout the summer and the whole of last year, India seemed to keep the number of cases low. I mean, of course, that's only the reported data that we have. But and so there was speculation that for example, in some of in Dharavi, the 2 million people, the slum, there wasn't the surge of cases that people were expecting. And so there was some speculation that, well, people have these immunities because they're already exposed to all kinds of diseases. And we didn't see the surge then, and we're seeing the surge now. And I'm wondering whether you have any insight as to why that is.
Okay, so good testing is very important. Accurate testing leads to accurate diagnosis and leads to accurate solutions. India's testing rate has improved, but it has remained very low over a period of time. In fact, for the last 1 month, it has even fallen. So test positivity rates have risen, even though testing has fallen. So you can see the situation here. That's the situation that we are faced with. Now, you spoke about the different models that we have. An excellent example is in the state of Kerala, where a system of testing, detailed system of contact tracing, isolating them in home and institutions, reverse quarantining the elderly, all of that has contributed to better public health infrastructure and care for the suffering people. In Dharavi, it's right across my street. I can see Dharavi from my window here. In Dharavi, there was an interesting effort because Dharavi is one of the most densely populated slums of the world. I say millions of people live there, and an outbreak there would have been catastrophic for the people living there and for Mumbai as a whole. In fact, the image of Mumbai as a financial capital of India and so on. So the government is very worried about that, and it put a good officer in charge of managing that pandemic in that area. And what that bureaucrat did was he did what a state like Kerala did on a state level basis. He implemented that on a slum. The slum itself is huge, and so there was testing was increased. There was enormous awareness campaigns done on masking, sanitization, distancing, and so on. The elderly were reverse quarantined into special houses. The testing improved, which means that the people who tested positive were isolated quickly. Their contacts were traced. They were also quarantined. These are basic steps. There is no rocket science here. These are simple steps involved in public health management, and that was done neatly and fairly efficiently in Dharavi. It took about a month. Community engagement was sought. The government was open. It opened itself up to the public. The public responded genuinely. Community organizations were tapped. They responded positively. They did their bit. So everyone sort of came together. The government and the community came together and did what a good public health system should typically do. It did not do anything, any flamboyant thing there. It did very what you would call in public health as dirty public health things. I mean, the dirty in the sense, not in a negative sense, but a lot of footwork, a lot of legwork. Talking to people, creating facilities. Simple things on the ground. That was done most effectively. That's how Dharavi managed the pandemic better than other parts. Even now, when the second round of waves came, Dharavi remained largely okay because they had learned from the first round fairly well. So there are examples like this, including in Dharavi. There are states like Kerala which have examples. There are also other locations like this. There are one or two districts in Rajasthan which have done fairly well, thanks to interesting work by bureaucrats there. There is a district called Nandurbar, which is a tribal-dominated district in Maharashtra, which has done fairly good because there is a very interesting district collector there who came from a tribal community, but who was very with ears to the ground, very grounded person, very efficient person who did some very interesting. So there are models like this you have in different pockets, but unfortunately these have not become part of overall state policy. That remains a challenge.
Thank you, Sharad. Thank you, Ram. So, thank you, Ram, for a wonderful time. That definitely the government, the RSS, what they call it a positivity initiative, is definitely a disaster initiative, what we call, and also that we need a dirty initiatives, as you told, that the 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 workers has to go, the health workers have to go and engage the people, create awareness, putting masks, taking simple steps, and meanwhile pressurizing the government through campaigns, through all the individuals, those who can with their capacity. That's what we have to do. Hope everybody here, also in this group, those who are attending the session, one way or another, they are involved mm, on this effort. Some people are raising funds and giving and getting oxygen ventilators, and some people are helping the people with the food and other stuff. So surely all they will continue their work. And after they listen to your speech, that they got the roots of this issue. So it will actually encourage them more morally to do their work more efficiently. Thank you. So if you have any closing remark, you can share, and with that we will close the session.
No, I have said what I wanted to say. I mean, the things that were left unsaid in my opening remarks were covered in the question answer. So, thank you. Let me take this opportunity to thank you all, and I am very happy to note that vaccinations have crossed 50% in the United States, and slowly United States is thinking about lifting the necessity for masks if you have vaccinated twice. That's very heartening news. You're slowly walking back to normality. Conditions in India are very bad. Every day, the news reaches us of one friend or one relative passing away. Even yesterday, one of my closest colleagues at office passed away. He was just 57, a wonderful sociologist. So we are all passing through a very difficult phase in India, and the public health initiatives are there on the one hand, which are required, but we also need vaccines. So there has to be a global effort to increase vaccine supply in India. If US can give some of its Oxford AstraZeneca stockpile, which it has created, and it is not using because it's using only Pfizer Moderna vaccines. It's giving a part of that stockpile to Canada and Mexico. Maybe it can give a part to India. So there are all things that globally can be done to help India. So that I would say that India needs help, and any effort globally that we can mobilize to help India, and also to politically persuade the Indian government to act in the right directions would actually be a wonderful thing to do. That becomes our political responsibility and task in today's difficult world. Thank you.